Hey, I am Dr. Amber Belt, and I am coming at you today with some skate thoughts. Let me warn you first. I haven't skated in about 3 weeks because I got sick about that time, and I just haven't been on my wheels since then. So hopefully I don't face plant into the asphalt because that's not what I want. It's a little distracting. But what I wanted to talk to you about today was kind of sick care versus health care, patient empowerment, why I teach, things like that. And what I want to start with today is talking about sick care versus health care. And earlier this week, I made a post about how conventional wisdom isn't always wise. And really what I was talking about in that post was the conventional medical system and how the quote-unquote wisdom we find there isn't always wise, I think that conventional medicine, it certainly has its place, and it's the dominant paradigm right now. But the main problem I see with it is that when you go to your doctor and you tell them a symptom, you just get a medication for that symptom. And it's very rare for a conventional practitioner to be able to, or to have the opportunity to, actually look for what's causing those issues. And that's concerning. It's really just scratching the surface. It's just the tip of the iceberg. So, when you go to the doctor for a headache, you get a headache medication. Or when you go to the doctor for irritable bowel syndrome, you just get medication to control bowel spasms, or to control diarrhea, or to control nausea. When really, if you dig deeper, there's something going on in the body to cause that level of inflammation. So I can think of so many examples of this during my, over 15 years of practice. I have one patient who was definitely in that boat with irritable bowel syndrome, and he was prescribed antispasmodic and antidiarrheal medications. He didn't want to take them, so he came to me, and we did some basic lab testing, and we also did some food testing. And simply by eliminating a few foods, his irritable bowel syndrome went away. He had way more energy, and his vitality, his zest for life, his life force, you could just tell he was a more vital person. And all we did was remove the foods that were not right for his system. I have a similar story about a patient with rheumatoid arthritis who was prescribed a heavy-hitting biologic drugs from his rheumatologist, but he didn't want to take those. I don't know if most people know, but those drugs that you take that modulate your immune system, that are often given for rheumatological disease, there's one that's being heavily advertised for migraines, those can increase your risk for cancer. So what we did for this patient, because he didn't want to increase his risk for cancer, we did some labs again. He eliminated a handful of foods, and I put him on a really low dose medication that helps the immune system to stay balanced. And he has needed 0 biologic drugs. He has no joint pain, which is awesome, right? And I think that, digging down for that root cause, it's not the easiest option all the time, right? It's not the easiest option because it's work. It's way more work than popping a pill. Sometimes it's not hard work, but sometimes it's really hard work because you have to change a lot about your life. So you kind of have to think about it and make the choice, Do you want to give up dairy and sugar and gluten or whatever foods don't agree with your system? Or is it worth it to you to keep eating those things and not feeling well? And I certainly respect everyone's choice, and I try to empower my patients to make the best choice for them. If you're seeing a doctor who isn't aware that there is choice in the matter, maybe you're seeing a doctor who has only studied medication and doesn't know herbs or nutrition or anything like that, you're not gonna know all of your options, but if you're seeing a doctor who has a broader array of ways to get to the root cause and therapeutics, your odds are better at achieving optimal health rather than just existing, popping a new pill every time a symptom comes up. So that's kind of my spiel on that. And I think the other thing that brings me around to is letting patients patients should have choices around their healthcare. I think a lot of times the conventional model uses fear as a big motivator to kind of get you to take the medication or have the surgery or whatever intervention they're offering. But my MO is more to educate my patient around all the options so that they can take that information with them, they can digest it, they can figure out what's going to fit in their life and what's doable for them at the time, and then they feel empowered to take that on. And patient empowerment and autonomy is one thing that's really, really missing these days. So empower yourself. Realize that you have control over your health. And I know some people have more limitations as to how much control they have than others, but find a doctor who will meet you where you are as far as that's concerned. Now, that brings me around to the reason that I love to teach. I have taught, I've been teaching nutrition courses for, so long. I want to say at least like 17 years. And I've taught my Cut the Crap in 21 Days program, and I'm teaching natural first aid starting this weekend. If you want to register for natural first aid, head over to my bio. I'm going to close the cart tomorrow, but tomorrow first thing in the morning. But one of the reasons I teach people, one of the reasons I post things on Instagram and Facebook and all of that is to empower people to get healthier and educate them to get healthier. And I also am a big believer in leading by example. So when I post a video about my veggie soup in the morning, my breakfast soup, I'm not messing around. I really do eat that stuff because I need to know what it's like to experience, a healthy lifestyle in order to teach it. And I am a firm believer in that too. So, I think that kind of brings me to the end of my skate thoughts today. I haven't managed to crash on my skates yet, so yay. And hopefully this motivates you to kind of feel more empowered to get healthy, to ask questions, to evaluate all your treatment options, to evaluate risks versus benefits of any medical intervention you undertake, whether it's a shot like a B12 shot or a shot like a biologic drug or a medication or an herb or whatever. You should always be evaluating, is this going to benefit my health? Is it going to empower me? And I think that's all. I hope that you enjoyed my skate thoughts, and I'll be back with more later. Bye.